Thank you so much for taking the time to review our Bachelor of Applied Science curriculum draft. We are really excited to get feedback from our college partners and our industry partners on this. The curriculum team has included several courses that exist and courses that need to be built. We are actually over the number of credits we can keep, but before we started trimming, we wanted feedback from you all. So please do review closely. All of the courses that exist already are hyperlinked in, so you can look at the course learning outcomes, the topical outline, etc. And we're looking for feedback of all kinds. So things to add, things to remove, if you don't think they're necessary, things to trim, or adjust maybe the credit hours that we're drafting for those new courses in behavioral health. Any feedback you have on this curriculum, please share, and we will get it finalized as soon as possible. So on the first page, you'll find the core curriculum draft. It includes general education credits on the top in green. Some of these are paired where a student will be required to take one, but not both, and they'll have a little bit of a choice there. The elective options will allow students to tailor even more, if they want to focus on corrections or Spanish even. At the bottom here, we have our CTE credits that we've drafted. And some of these, again, are courses that exist or need to be built. And the build classes have come from our conversations with our industry partners that have said, this is what we need mid-level behavioral health practitioners to know. And so we're ensuring that the systems focus, the understanding trauma, advanced case management, things like that are built in here. There is room as well for another course here, for example, for elective options. So if you see something that's not listed, this is where we could build a new course within that BEH prefix, just like these up here. So these are recommendations from the curriculum team, but you all may have recommendations as well. On the second page, you'll find the two tracks that we have continued from the AAS into the BAS. We've modified this first one slightly to mental health and wellness. And this has, again, some general education courses as well as CTE courses. You'll note on both of these pathways, there are internship or experiential learning hours built in. Please do let us know. We've built them as 5 credit hour internships. If that seems like more than might be needed for this program, you can provide that feedback. Or if you feel strongly that no, we should definitely have, that 5 credit hour availability for this type of learning here, you can provide that feedback. Then this last emphasis area for addiction recovery, 1 general education course added in here, and then the others are the existing courses through the BHA that will add into our CCNS system, but these would all meet the CAS training requirements that were not included yet in the AAS. So we would ensure that students would be able to finish all of their required coursework for the CAS through their BAS. And then again, we did build in internship or experiential learning practicum hours here. So while they're working on those CAT and CAS hours, they will be able to earn credit for those by having that built in. So again, you'll notice some highlighting in yellow and red, which just indicates that we are over our credit maximum of 120. We pull in the AAS 67 credit hours plus the core, which at its current drafting is 50. And then each pathway is slightly different, and we will need to get those in line with each other as well. So yes, please take the time to explore, look at the courses individually or look holistically and provide any and all feedback you have on what should be added, removed, revised, where we should focus, or just general feedback will really help the curriculum team get this finalized and serve our industry partners' needs as well as our student needs. Thank you so much.